So, how and why did you decide to touch upon this topic?
Well, it's something I was very aware of in myself from the time I started out, especially as an early career therapist.
Yeah.
We don't really talk about that, but I felt unbelievably vulnerable. And because I didn't feel confident in what I was doing. And because I was overwhelmed with the feelings that I was having in response to my patients and how they reacted to me and their issues and pain. And I wrote about that in my previous books. But, I think each of us has a tendency to think that our individual experience and our fears and our vulnerabilities are unique to us, and that other therapists don't necessarily share those fears and those struggles. And because we don't talk about it publicly, I think it's remained that way in the shadows. And what brought it to light and made me want to write about it is that as a senior analyst, my practice has become, over the years, almost all therapists.
Mm.
You become, when you're very senior and well-known, you become the therapist.
Yeah.
So most of my practice is treating and supervising other therapists. And so that has provided a wealth of, knowledge for me that I did not have previously. And I began to see that as different as all of the different therapists were who came to me, and different in their credentials, different in their backgrounds, socioeconomic status, family constellation, everything, I began to see these really common threads, and threads that I could relate to myself. And I think I elaborated on those in the book. For example, a tendency to be quite passive.
Absolutely, yeah.
Tendency to be passive rather than active, and exaggerated, and I think, quite frankly, irrational fear of doing harm. A conflict avoidance. And when I saw all these things, I thought, where does this come from? What is this all about? And
how did you end up here? Yeah.
Yeah. Why do we all share these characteristics? I mean, maybe not all therapists share all of them. Like, for example, I was never as afraid of conflict as many of the people are who I treat, because that was allowed in my family of origin. But for most of us who grew up so then I started thinking, well, what do we all have in common in our backgrounds? What stories keep appearing? And even though it's been well documented and discussed, albeit briefly, that we all were soothers, peacemakers in our families of origin, that we were sensitive, we were the sensitive, empathic child who was tapped,
we had like a designated function from the get-go.
Yeah, the term that people use often is parentified child.
Yeah.
And it's really the position that Alice Miller writes, is that being burdened at not having your needs adequately met. And as soon as you were in some ways more capable than your parents, you were tapped into this adult function precociously. And there was something that people liked about it and still do. It's like there was a feeling of specialness that went with that, a pride in the ability to do these things, to provide this, but also a tremendous burden. And also, I say that as children, when we were tapped, we didn't even have observing egos, most of us, at that point in our development, right? So we just assumed that this was okay, and we were needed in this way. And our parents often were grateful that we provided, that soothing or peacekeeping or entertaining function for them. But as children, we didn't even have the knowledge of what was going on in the family, really, in the terms of the dynamics, because developmentally, we just weren't capable of that. So being in conflict with our parents, confronting them, particularly when they were in pain, was just not an option. And so our childhood roles did force us to be somewhat significantly passive and just doing what was asked of us. And I think that has carried over and does carry over into adulthood. And because it's not examined in the analytic literature, and I believe it's not examined in most people's personal treatment either, because my analyst grew up the same way I did. Her analyst grew up the same way she did. And so it's like a hidden confounding variable in every treatment.
Yeah, absolutely. I think that what is extremely refreshing of this point of view of yours is that you are not afraid to talk about your early experiences.
Well, I can't point out these vulnerabilities in other people.
Yeah.
Without and say that these are close to universals.
Yeah.
And not include my own experience or make myself vulnerable to some extent. That would be hypocritical, I think.
And at the same time, you talk about several kinds of vulnerabilities we might have. There is a narcissistic vulnerability. There is a kind of, at least that's how I have read it. There is a kind of avoidance of vulnerability in avoiding conflict, for example.
Yes.
Because there is a generation, I think, of therapists who still think that conflict is a bad thing, that negative transference is something heavy and extremely heated that cannot be managed. And so when I read your book, I found it very, very refreshing because it touches upon topics that we take for granted, or it's like we don't have to discuss those things, and you do. And this is what really was enthralling to me.
Well, you know, it's been very surprising to me, Dr. Idone, is that I wrote this book. I wrote most of it. I did most of the research for it. It's heavily researched, as you see, especially in the second half.
Yeah.
Where I talk about mirror neurons, and enactment and other issues. And so it was a very heavily researched book. I completed all that before the pandemic, but I actually wrote most of the book during the pandemic. And my other books were written with, consulting groups, readers, and people were so overwhelmed. I couldn't even find my usual colleagues to be readers on the book. It's like, oh no, I'm overwhelmed. I've got this, I've got that. And people were stressed. So I wrote this book in isolation in many respects. And the good news about the pandemic is it allowed me, because especially before the vaccine, we weren't going anywhere, especially someone of my age, vulnerable. Speaking of vulnerability, I did not want to get COVID, and before I was vaccinated, and I did not. But that meant long weekends at home.
Alone by yourself? Yeah, absolutely.
Well, no, I have a partner, but I was, we weren't
in a kind of solitude, creative solitude, so to speak.
Yes. But I found it, I became incredibly engaged with the material, and it was very satisfying, and I loved writing it. And it really made the pandemic, being able to be creative and write with that kind of consistency and intensity was really a wonderful experience that really helped me through the pandemic.
This is wonderful. Yeah. How such an experience of global vulnerability has translated to you into a very creative moment.
Yeah, it was just wonderful to have that time to be creative. But the downside was I didn't know what anyone would think of the book because I wasn't getting feedback. So I just kept writing what I thought and what I felt. And I thought I really had no idea how the book was going to be received. And I thought, are people really going to embrace this? Or is this going to be too controversial? And are they going to just reject this book out of hand? Not because, no, I'm not vulnerable. So I expected at best a mixed reaction to the book. And I've been quite pleasantly surprised and pleased that the book is very popular. And people are relieved rather than defensive when they read it.
Yes, this is what I felt once I have read the book, a sense of relief and a sense of, there is someone out there, there is a colleague out there that is not afraid to touch upon those topics. And she is not afraid to speak about those controversial topics that we usually prefer to avoid because of, I don't know, maybe it really has to do with vulnerability. Maybe it has to do with the analyst persona, which is something you write about in your book.
Yes.
Our analytic images towards society, for example. And so, well, I had a feeling that you were at least, if not pleased while writing this book, very engaged. This is what I felt.
I was very engaged.
Very engaged. And I would also, I have some notes here with me because there are so many things I would like to ask you, but I will try to keep it short and effective. My second question to you has to do with our global state of vulnerability, both as analysts and patients, but also the whole world seem at the same time more dangerous and more vulnerable. So
indeed,
I'm not just talking about wars and pandemics, but also I think we're seeing the crumbling of old pillars of security, and I'm referring to society, work, family, relationships. So what's your view on this topic? Do you feel those influences on your work?
I do. I find myself very disturbed about what's going on in the world. I find particularly what's happening in Ukraine to be unbelievably heartbreaking. Yeah.
Yes.
And I'm concerned about, what Putin might do next in Europe, as I'm sure all Europeans must be.
Yes.
So, but I also feel that there's a heaviness that surrounds everyone. Not only is my practice very full with, new patients, many of my former patients are coming back and wanting to be seen because they feel so stressed by what's going on. People do no longer feel safe. Even my most affluent patients do not feel safe because it's one of those things that has both positive and negative aspects to it. I'm heartened by the fact that even the people who have the capacity to insulate themselves from almost everything, including flying private jets, are affected by this. And so that everyone you can't escape feeling it. And I often wondered, how much do people feel who can remove themselves? But they do. I think that everyone is concerned and frightened and stressed by what's happening internationally, and beginning in some ways to lose hope that there's going to be any meaningful change in our lifetime, especially for those of us who are older. And I think it weighs on everyone. I'm not as happy. I don't experience as much joy in my life. And I know my patients don't either. So I think that prevailing, and if you look at the data, at least here in this country, on hospital presentations, psych emergencies, and suicide and suicide attempts in younger people, it's horrific. Yeah. Our young people are incredibly anxious. And so I also fear for the coming generations, because the people who are growing up in this feel very unsafe.
And I think that it's very interesting that you say that some of your former patients come back to you. Yes. Resume an analysis or maybe psychotherapy. But it strikes me because I think it signifies that after all, the human relationships can really give us security. The therapeutic relationship is one of the most important sources of security. At least this is how we like to think about it.
Mm-hmm.
That's very interesting.
Yeah, I think you're right. They're looking to be better grounded.
Yeah.
Yeah.
I would also like to ask you, well, this is more of a reflection of the time being. I was asking myself, after having read your book, many questions. One of those I wanted to ask you directly, because I think it might help us try to get a clear view over what lies ahead is, do you think there are new vulnerabilities, so to speak, among our patients and also in our line of work? And if so, do you think that we have the right set of tools to help those patients without renouncing to our psychoanalytic tradition?
Well, maybe you could help me by saying more specifically what population you're thinking of. I know
Yes.
people often feel that the treatment has to be different, for example, with people who have trauma backgrounds.
Yes.
And have modified the treatment to the extent that people would not say it's analysis necessarily. Are you referring to something like that, or?
I was thinking more in the line of, for example, those kind of narcissistic vulnerabilities that come from the constant exposure to social media and models, role models that especially the younger generation tend to absorb. I
think it creates an issue in the sense that there's such a, I write about our pursuit of perfection in the therapeutic or analytic persona, that we expect ourselves to be perfect.
Yes.
But I think that our patients definitely do. I think that the people suffer from the the commonly discussed Facebook phenomenon, and even the people who know it are affected by it. They say, I know that picture of that person was, posed and they, made everything sound wonderful. Yeah. But yet they will still feel envious. I think that so much of our society is built around trying to stimulate envy in other people and create an aura of perfection. But that is internalized as well. So that people aren't comfortable at all with their negative feelings, with their sadness, with their despair. And I think that's connected to the increase in suicides and drug abuse. Yes. Because there's too much guilt and shame associated with being human. And that's absolutely tragic. Absolutely. It is. Because maybe that kind of society we renounced back in the days had a kind of a buffering function. Yes. And now everyone is directly exposed to those models without a kind of a filter, a psychological filter. Yeah, I mean, when I was a child, I was a practicing Catholic, and I no longer practice, but I think the Catholic faith was a grounding, I would have to admit, even though I'm agnostic now, the Catholic faith was a grounding part of my life. And as much as Catholicism could induce a great deal of guilt, there was something very basic about going to confession every Friday. It's like, yes, I have sinned, and we all sin. And this is part of life. We are weak, we are vulnerable. Yeah. We will sin, but we will be forgiven. There is redemption. And those concepts are almost non-existent. Yeah. Maybe church attendance, whatever confession, I mean, maybe church attendance was one of those pillars of society that got destroyed. Yes. Yeah. And religion in general, I think religion has existed since the beginning of humanity for a reason, right? It has a social function aside from whether you believe in a deity or not. And as people often say, we haven't replaced it. Certainly social media and Facebook has not replaced, religion. and the tremendous support system that comes from with religion, with being active in a church,
Yeah.
sense of community.
Yeah, because social ties are loosening year after year, and so we really are going towards a completely atomized society.
Although some people feel that maybe that's reversing, because so many young people came back to live with their parents during the pandemic.
Yes.
And discovered the value of that and have decided to move closer to family, and especially as they marry and have their own children. So I think there's some hope that some of these things will reverse, but I think social media is a scourge.
Well, there are also another couple of questions I would like to ask you, if you agree. We have some more minutes to go, and well, this is more of something that has to do with your contacts with Europe. I wanted to ask you if you previously had any contact with Italian psychoanalytic societies or associations, and if so, how was your experience?
No, actually, I have never been engaged by anyone from Italy before.
Oh, so this is the first time?
It is the very first time, yes.
Okay. And
my work is well known, and I've been to London, and I communicate with them and I present there. And a few years ago, I was in Poland. There's a Polish translation of my previous book. And
I've seen an interview of you on YouTube, and you were talking about that book. Yes, I
yes.
yeah. So you also talk about the theme of sacrifice in the context of psychotherapy, citing clinical cases where the analyst had to submit to every request coming from the patient in order to have him have a sort of corrective experience. So this is the right term, corrective experience. Some approaches tend to highlight this tendency, while others are much more rigid and frustrating for the patient, and for good reasons, I would say. What would you suggest to a young therapist who still is not experienced enough in navigating this continuum between total support and total interpretation?
I think that's an excellent question, because certainly early career therapists struggle with it, and many senior therapists struggle with it too. Especially when the patient is not a demanding patient, but someone who's in heartfelt, deep pain. How much do you minister to that person? And more importantly, what is therapeutic? And my own perspective that I write about in the book is that when you start to blur the boundaries between the professional and the personal, then I think that you are doing a disservice to the patient. Because one of the frustrations that brings about the needed grieving process is what can't be. That we can't be the perfect parent that they
Yes,
need.
absolutely.
We can't make up for what happened to them as children. That so much of what the analytic process involves, what's therapeutic, is that grieving. So that if you are gratifying the patient and soothing and comforting them continually, you're giving the impression that you can and will fill that void, that you will in a sense fulfill their rescue fantasies, rather than promoting the necessary grieving. And I think that's part of what contributes to endless treatments, because the patient never can let go, because you're part of their daily life and meeting their needs, and not really sufficiently helping them to grieve and move on and be independent. So I think it creates a false illusion about what the relationship is and can be. It interferes with possible termination and independence, and often ends badly when the patient pushes for more and more And that line in the sand finally has to be drawn.
Yeah, because I mean, setting up boundaries later is quite difficult because the patient is now getting used to have
Right.
those kind of care.
I know, I always tell young therapists, before you give something, think about whether you want to give it indefinitely.